Well, good every morning, everyone, and thank you for joining us today to look at some of the helpful resources that can be found on the CMS website. My name is Karen Curtis, and I am a provider outreach and education specialist here at WPS. Today, I am joined by my friend and coworker, Tom Ryan. Tom will be monitoring the chat for questions, as well as providing you with some additional information and links. I have just a couple things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center, along with a list of our upcoming events. Tom will also add a link in the chat that'll get you there quickly. Our training center also contains a web page for our encore presentations, videos that are available for up to 90 days and can be watched on our web page without you having to go to YouTube. We do know that there are some of you who may not be able to access YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Each encore is posted with a link that will allow you to download a copy of the presentation. You will also be given another chance to complete a survey and provide your feedback. Today's presentation is being recorded, and if there are no technical issues, this will be posted to our website soon. Oh, sorry about that. Later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those in the chat feature. If there are any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we are doing, so later in this presentation, you will be given the opportunity to fill out a survey. This is your chance to let us know what we're doing right. Let us know if you feel that there are areas where we can improve. And it also allows you to give us input on what types of education you would like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements you ask for. And this is the disclaimer that we put out. The material I'm covering today is on the CMS website, so we normally tell you that Medicare rules change often and to check the CMS's website, but we're going to go out there today. Also, this does let you know that CMS does prohibit recording of this webinar, so we ask that you don't do that. We are recording it, and it will be available on our website and on our YouTube channel at a later date. So today I'm going to show you some of the resources that can be found on the CMS website. I've provided slides, but what I'm going to do is I'm just going to go out to the website and do a live demonstration. So if you have a copy of the presentation and you just want to take notes on it, that's fine, but we're just going to go out there. Tom, can you verify that you can see the CMS website?
Yes, Karen, the CMS website's up.
Great, thank you. Okay, so the first thing, I'm going to kind of go in order as to how we can find it going down the Medicare links. So the first thing I want to look at today is the Medicare coverage database. So we're going to click on Medicare. I'm going to go to coverage, and then I'm going to go to the Medicare coverage database. Now, this database can help you find out if a service is covered by Medicare or not. There's even a section that helps beneficiaries, so right here. If they find a service that has been denied, they can come out here to find documentation that may help them understand why. There are a couple of different options for searching. If I stay on the search page, which is highlighted right now, so that's what I'm on. And in the search field, I'm just going to type in mammograms. So you can see that I'm provided with a list of national coverage determination. There's articles. If I scroll down more, there's LCDs or local coverage determinations, and the NCA, which stands for National Coverage Analysis. So for the articles and the LCDs in the database, you're going to see the list of the contractor that it belongs to. So that may be something that you want to pay attention to, especially for like the local coverage determinations, just because like for here, just because First Coast has one, you can see that WPS doesn't have one out here. So you'll just kind of want to pay attention to that when you go out here and look at these. So up here, you can also see that you can refine your search. So you can choose what type you want to look at. You can narrow it by states, contractors, just kind of depending on what you're looking for. Now, if I go over and choose reports, I'll just pick, it has all the list of national and local coverage. So I can choose, we'll choose local coverage, final LCDs by contractor report. Then I can go and I can pick WPS. If I want to narrow it down by jurisdiction, I can do that, but I'm just going to look at all of them. So this will let you know what LCDs WPS has out there. It has effective dates, last updated. You have the status over here that lets you know if they're still active. Here's one that's future. So just another way that you can look at stuff and maybe narrow it down specifically for our contract. The download options just gives you options where you can download the current LCDs, current articles. I don't know if that'd be something that would interest you, or if it's more you just want to go out there and find what you're looking for, but that is just another option. So I'm going to go back to the cms.gov website. The next thing I want to look at is the Medicare Preventive Services tool. This is one that I really like. So, and partially because I'm doing a series on preventative services. So this is something I bring up in my webinars because I think it's helpful. I am actually holding a webinar next month just on this particular tool. But I just wanted to show you in case you can't make it to that webinar, I want to at least show everyone where it is. If we go to coverage and then preventive services, if I scroll down to resources, and we have the Medicare Preventive Services Education Tool. So this tool gives NCD billing and coverage information, frequency limitations, and if a service is telehealth eligible. So you can see right here, these that have a T by it would mean that it is telehealth eligible. If I click on, we'll just do annual wellness visits. It gives the HCPCS and CPT codes, ICD-10 if one would be required, talks about Medicare coverage, frequency. Here it tells you what the patient pays, if they owe anything. And then if we go down to other notes, it has additional links. Now there are some, if I go back and let's do diabetes, nope, sorry about that. Trying to think. If there was an LCD associated with it, it would be located right underneath the topic, and then it would be a link, so it would take you directly to the LCD. But that's something that I find really helpful, and I think it's kind of an easy reference, so you aren't having to search through the online manuals, something that you can get to quick and find information. Speaking of online manuals, that is where we will go to next. So for the internet-only manuals, I'm going to switch down to regulations and guidance, manuals, and then the internet-only manuals. So you can see right up here at the top that it states that the internet-only manuals are a replica of the agency's official record copy. So it is considered the official source of documentation for Medicare. Of course, I'm not going to go through all of these, but I did want to point out some. Publication 100-1 gives a general overview of the Medicare program. It also has deductible and coinsurance amounts, physician certification and recertification. 100-2, which is the Medicare Benefit Policy Manual. This starts to break down things a little more. You can see inpatient hospital, psychiatric hospitals, lifetime reserve days, home health. It's got ambulance services. Here's rural health clinic and federally qualified health center services. This also has the NCD manual, and it has it broken down into sections. Medicare secondary payer claims process. So there's just a lot of information out here that can help you with your billing. I know the Medicare claims processing manual, I reference that a lot because it does give things that should be on your claim when you submit it to Medicare. We'll go back here. Next, I'll take you to the transmittals. And I'm just going to click on 2024. So one thing to keep in mind when we're looking at transmittals, this allows you to see all the new or the changed policies that Medicare is going to incorporate into their online manuals. One thing to keep in mind is that these transmittals have issue dates, they have effective dates, and they have implementation dates. So let's talk about that for just a second. I'm just going to click on this top one here. We have an issue date. So that's the date that CMS publishes a change request. If I go in here, and it has the actual change request, the effective date is when the new rules, the laws, or the processes become active. So this may not always be a future date. The implementation date that you see here is when contractors such as WPS have to apply these changes and make any necessary updates that need to be put in place. Now, additionally, a transmittal can also mention dates of service. So this refers to the date that a provider renders the service to a beneficiary. Now, you may be wondering why I'm explaining all this, and the reason is because I'm sure that many of you have been affected by mass adjustments or claim holds. Now, when MACs receive a change request, which lists an effective date or dates of service in the past, then CMS may require MACs to search their system for claims that processed incorrectly. And where you're normally going to find that is if you scroll down here and we look at the business requirements. This, of course, this particular CR that I chose doesn't have any changes like that that need to be made. But if you see wording in here in these business requirements and it says that Max will process claims brought to their attention, then that means that if you have any claims that processed incorrectly, you're going to have to notify us so that we can adjust those claims and make changes to them. In other words, if it says that it's only going to be brought to our attention, we're not going to search the system. You'll just want to make sure that you do take action if your claims are affected. We'll go back. Now, the next one I found was just kind of a reference, but I thought it would be helpful. If we go to the coding and billing and I go to the place of service. Now, this is going to be for professional claims that go on the CMS 1500 or an 837I. Over here to the side, it has place of service code set. So if I click on that, it's just going to give you all of the place of service codes. And kind of give a description of them. So I just thought that might be something that could be helpful if you're wondering what place of service you should be putting on the claim. CMS does have a resource out there that gives you a whole list. Next, we'll go to the Integrated Outpatient Code Editor. The Integrated Outpatient Code Editor processes outpatient institutional claims. So this page will give you some information regarding the IOCE. You can download the software packages and data files. It gives you the purpose of the Outpatient Code Editor. I did previously download the October quarter. Let me pull that up real quick so you can just kind of see what it looks like. So here's what it looks like when you download the quarterly files. You can choose the final summary of data changes. Sorry, it's taking a while here. And this will just give you, let you know what changes were done. It has diagnosis code changes, APC changes, HCPC changes, just so you can see what they actually changed. Now this, the integrated OCE specs, I always kind of found this helpful, especially when it comes to OCE edits, because a lot of claims can get denied for OCE edits. I'm going to go specifically to page 87 because I know that's where it starts. This I find helpful. It has the last 1 or 2 digits of the reason code. The reason code is always going to, or I shouldn't say always, normally starts with the W70. It gives an edit description. It tells you a reason why the claim's editing. Tells you what's going to happen with the claim. So this claim is going to RTP and it's going to be a claim level reason code. Some of these are line level. You can see line level denial, line level rejection. Some of these provide extra links. So if you see that your claim's editing and you read this and you're like, I still don't understand, it gives extra links for additional information that can maybe help you figure out why your claim's editing and what changes maybe you could do to get that claim to process through the system. It also has report tables. These are bunch of Excel spreadsheets. I'll just click on the HCPC one. Sorry, this is taking so long. Should have had that open beforehand. Okay. So this just lists the HCPCS codes, the description, status indicators, just something that can provide you with information if you're specifically looking for something on a HCPCS code. So hopefully that's something that could help some of you looking for more information on that. Next, I want to take you to the NCCI edits. This is also another big one. This is a lot of times a requested topic for education. So these edits help ensure proper coding of Medicare Part B claims. Under the NCI implementation, it gives you a booklet on how to use the NCCI tools. So that's something you could find helpful. It has pictures of the tools, kind of describes, goes through the columns. There are additional links over here on the left. So they have like Medicare NCCI policies, and then additional links for resources down there. If we look further back on this main page, there's contact information, but there's also information on submitting appeals in an appeals website. So that would help you get through that process. And then down at the bottom here, sorry for all the scrolling, it has a lot of additional downloads and related links. Next, I want to take you, we'll start with the coding and billing. I'm sorry, payment for fee schedules. I know this is another one that gets brought up a lot. These are used to determine reimbursement for Medicare providers. So here it has the zip code to carrier locality file. I won't pull it up since everything's taking so much time for my computer to download, but you can see information. It basically maps a zip code to a carrier and lets you know if that provider is rural or not. To the left here, you can see that it has specific fee schedules. So if you want physician or if you want the ambulance fee schedule, you can click on those and then it will give you the files for that. Just kind of depending on what you're looking for. But this also kind of opens it up and gives you more options. Now, similar to this would be the prospective payment system. So this will be more for the institutional claims. Here you can see it still has a zip code to carrier locality. So that's kind of going to be the same thing where you can narrow down a zip code to the contractor. To the left here, you have different categories. The HIPS code, that actually goes through all of the different HIPS codes. It tells you if it's for a SNF, if it's for an IRF, a home health agency, kind of takes you through all of those. If I click on that again, actually, if I go down here, if I go to the acute inpatient PPS, it'll give you different links so you can get things more specific. Updates are listed by quarter. For some of these, but hopefully that would be something else that you would find helpful. Sorry, I'm kind of running out of time here. So the Medicare Learning Network, this is under Education and Training, Medicare Learning Network. The resources and training, publications and multimedia. This gives everything in a really user-friendly. Here's the Medicare Preventive Services, the education tool that we looked at earlier. It has fact sheets, guides. This just puts everything in really user-friendly information, kind of spaces everything out, has additional links. If there's things that have been updated, they'll put it in red so you know that that's something new. We'll go back. Web-based training would be kind of videos and information that they put out there if that's something that you're interested in. The MLN Matters articles are it's just like the Transmittal web page that we looked at earlier. There are MLN Connects newsletters. This is something you could subscribe to the weekly newsletter, and this just gives you updated information on everything. So that's something that'd be really great to subscribe to so that you continue to get updates of changes that CMS is making, just things like that. I do want to take you to the provider compliance. This Medicare Provider Compliance Tips education tool was something that I thought was really neat. If I just click on a topic, we'll click on ambulance. It has what's changed, affected providers, gives you some background information, denial reasons, and it gives you tips for preventing denials of emergency ambulance services. So that's something that I thought would be very helpful. I thought that was a great tool. The last thing that I want to show you is if I scroll all the way down to the bottom here, under tools is acronyms. So we know Medicare is filled with acronyms. Even after all the years that I've been doing it, there's still ones I don't know. So this would always be something that if you're going through things and you're like, what does this mean? You can go out to the CMS website and you can check that out. I'm gonna go, forgive me as I scroll through this really quick, and I apologize for running over here. I don't have time for questions, but if there's anything specific you're looking for, then please add it to the chat. We can look into it. You can email us. I'll tell you about that in just a minute. But I have provided links to all of the resources that we went through today. Again, I apologize for no questions and answers. I also want to let you know that the eligibility function is being disabled in our IVR effective January 1st of 2025. We do have other resources for eligibility, including the portal, direct data entry for providers who use FIS, and the HIPAA eligibility transaction system known as HETS. We will be holding a bunch of webinars on the portal eligibility and on DDE eligibility, how you can get signed up, and what you can find using those tools. Now, shortly after we end this webinar, you are going to get an email that is going to be able to use for your proof of attendance in case you need that for continuing education units. If you dialed in only, then you will not get this email. You'll need to email our education mailbox, and we will get one sent out to you. If you do think of anything, any follow-up questions, you can send an email to wps.gha.education@wpsic.com. Put in today's topics, and they will get that directly to me so that I can help you out. Again, we would really like you to take our survey. It just lets us know how we're doing, if there's things that we need to improve on, and it allows you to let us know what you want us to educate on. There will be, when this closes out, you will be redirected to a site and it will pop up looking like this. That is not spam or anything malicious. It is the CMS website for the survey. Now that brings us to the end of today's presentation. On behalf of myself, Tom, and Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will enjoy us for future events. Enjoy Halloween, everyone, and you may now disconnect.